good? No. There we go.
Facebook is on.
We're good.
Okay. We're crooked or straight?
Well, we'll find out.
And you're ready?
Sure.
Here we go.
Yeah,
Welcome to the River Park Dental Show. I'm Dr. Phing Saurer, and I'm here with Michael Morris.
Dr. Phing, I'm excited. This is our first show. Are you excited?
Yes, very excited.
You've got like a really big smile going on, so I can tell you're very confident about this today.
Sure.
I thought we would start, actually, there's news, important national news for you, that you won an award yesterday.
Yes, I did.
And that award was, and again, this is not a local thing. You didn't win like something at the state fair. You won something nationally in your field. So can you tell people what that was?
Yes, it is Benko's Incisal Edges 40 under 40.
Say it again in case people were writing it down.
Benko's Incisal Edge 40 under 40 Dentist.
So that lets people know two things: that you're very successful and very good at this, but also that you're under 40.
Yes, I barely made the cut though. I had 8 months.
Well, I know you're not supposed to ask a lady how old she is, but I just thought it was really important that we would stress you are not that old and won this award, and that's pretty big.
Yeah. It was actually, I felt really honored when they gave me the phone call yesterday. I was just cleaning, and then they called me and told me that I was selected for this this award. So.
It's kind of a big deal because I went on the website to see what this was, and everybody on here kind of looks like a model. Like this looks like the cast of The Apprentice. When I'm looking at these pictures, everybody's all dolled up, so you will be on the cover of this magazine.
Yes, so they actually will fly me out to New York City, and then I think there's a Forbes magazine thing, and a glam squad, and a stylist, and all things I'm not familiar with, but then they'll make me look like a model.
Is this typical for dentistry? You kind of
No.
get flown out to New York because it's that big a deal?
I mean, it is a big deal, but no, that's not typical.
How did you, I know you have to get nominated for this, but
Yeah.
what, do they kind of tell you the reasons why you're picked for this?
They didn't. They didn't give me any specifics, and we even asked who nominated. They wouldn't tell me who did, but they said several people did, and then I was selected. So.
Well, I can tell you it wasn't me.
Well,
But I would have, but we've only met just recently, so.
I know.
But I think that is a really cool thing to win an award, and then we follow up with a radio show. So you're having a real excellent week.
This is probably the best week professionally for me.
Well, you're welcome. I wanted people to understand that the part of the reason we're doing the show is that I find it fascinating that I don't meet a lot of female dentists in our walk of life,
Yeah.
but also the fact that you are kind of on the cutting edge of technology as far as dentistry. But I wanted people to know a little bit about you, like who you are in your background. And I don't mean like where you went to college. I mean, you have a very unique story of how you've come this far.
Sure. I guess it's since I've lived it. I don't find myself that interesting, but
Oh, don't get me wrong. I don't find you that interesting. I just find the story interesting.
okay.
Because Ellen, who works in your office and also went to high school with me, she was kind of telling us the background about your parents and everything else. So it is like you've accomplished a lot before the age of 40, and that is documented because you won an award for being under 40.
Yes, for being under 40. That's true.
But if you can kind of break down, how you got into this industry, I think that would tell a better story.
Okay. Well, do you want to start from the very beginning, like my parents?
Sure, we have 26
Or are we
minutes to
talking
fill
about,
today,
like-
so you could.
So you don't care about college?
I mean, you can get there, but I'd like you to talk about your parents first because
Okay.
I think people on the radio are not they can't see you, so they don't realize how, one, diminutive you are, but also.
I am a very tall 5 foot.
Yeah, it's a solid 4'11" for sure.
It's a hard 5'1".
Yeah.
So, well, my parents were immigrants from China, and they moved. They had brought all the kids over. They just wanted to reach the American dream. So they always pushed the working hard, going to school, doing all that kind of stuff. And then, so I did, and skipped a whole bunch of years, went to college, skipped some more years, and then I was kind of in this place where I didn't know what I wanted to do. And I thought I wanted to go to medical school for a really long time until it came to the point where I actually had to put in my application, and then I didn't want to do it. So I just took a year off, and I worked in the dental office helping this a periodontist with research. And a periodontist is a gum doctor. So I was helping him with his research, and then he just kind of watched me do some things. I don't even remember what I was doing, but he mentioned that I had really nice hand skills. So he asked if I ever considered going to dental school, and I said, no, I never did. But then once I looked into it, it made perfect sense because I like working with my hands. I like working with people. And
Keep bringing up hands.
I know.
So
I
it's
know,
making me look at your hand while you're doing this. So go ahead.
My small carny hands.
Yes.
Yes. It
I feel
smells
like
like
you could,
cabbage.
yeah, you could pick locks with those fingers. But yeah, go ahead.
So I, at that time, there was a new program that was coming out. It was a dual degree program for my DDS and my PhD. So he recommended I try apply for that into that program, which I got accepted. And so I did a 7-year program at Ohio State, getting both degrees at once.
That's why we call you, people don't know this, but we call you Dr. Phing because
Yes.
you have two
I make
doctorates.
everyone call me doctor.
Yeah. Especially people that know you
Even my
really well.
kids. Yeah,
Yeah.
I tell them.
Do they have to address you that way for you to care for them?
doctor.
Yeah, that's good.
Yeah.
I would do it too. I don't have a doctorate in anything, but I would definitely push that. So you get both of those degrees, and then you worked in the field for an additional 7 years, wasn't it?
Yeah, 7.5 years, just as an associate, because I was growing my family, and, it's hard to, I wanted to balance things out. So I had my kids first, and then when it was time to go, then I moved on, and I opened up my own practice.
And your practice is now in the River Park area, which is why it's
The
called...
Bridge Park area.
Bridge Park
Yeah.
area. That's why it's called River Park, because it's
by a
synergy.
river, and it's going to be by a park. So I was very creative in how I named my practice.
Yeah, I was wondering when we drove in there, I'm like, why not Bridge Park? But it's fine. River Park will work.
Yeah.
I mean, it's the name of the show, so we kind of have to stick with it.
Right.
So we toured your facility, and I was amazed at all the technology in there because I've been to dental offices. I mean, I'm 42 years old, so I've been to plenty of them. They all look like an old cottage house type deal.
Okay.
And you have like 3 or 4 ops for a hygienist, and then there's 1 or 2 dentists kind of roaming around. But I've never seen the level of technology that you have there. So you're on the forefront of that. What's the tagline in the commercials? It's tomorrow's dentistry today.
Yes, where we practice tomorrow's dentistry today.
You should do commercials like that. That would be a perfect tagline.
I've been practicing, with the lemon tea.
Yes, I will say this, that was one of the big things when we first met, lemon tea. You thought that would like really bring your
it
voice.
makes my voice more soothing.
Yeah, yeah, it's very soothing when you say that. So I want to get into why the technology at your office, like why did you invest in that?
It was technology is cool, but only if it actually makes it convenient and comfortable for patients. So there's a lot more that I could get by, but only if it makes sense in terms of how it is affecting the patient. So like one example I'm thinking of is just my digital scanner. So the traditional way is using that goopy material that people hate, it tastes gross, they bite in it and bite into it for about 4 or 5 minutes, and it's uncomfortable, they think it's going to go down their throat, it's just a mess.
It's pleasant.
Yeah, it's really, really pleasant.
Yeah,
Everyone loves it.
enjoy it.
Yeah, they always write positive reviews about it. So I got the digital scanner, and you just scan their teeth, and then send it in to a lab, and then, or actually, I'll be making my own crowns once I get this new mill that hasn't come out yet. But then you just make everything in house, and it's convenient for the patient, so that they don't have to come back, and they don't have to come back 2 weeks later to get a crown and have to wear a temporary crown. So there's a lot that's involved with just their comfort and their convenience.
But that's kind of why you have these. I don't want to call them machines, but each op has so many different things to it, and your whole thing is to kind of take the discomfort or the fear out of these things, right?
Right.
So when you looked into that, I mean, how much research did you have to do? Because there's not just 1 or 2 things that you have there that are different. It is. You have to see it. First of all, it looks like a spa when you walk in the front door. So I thought I was in the wrong place. But when you walk through there, Ellen had showed us all the different machines that you had. And it literally is you can get your whole family taken care of in one place.
Right. That's the goal. That's the other thing that so when I created this practice, it was just, again, making a list of everything that people have told me in the years that I've practiced about the things they didn't like about going to the dental office. Whether it's convenience, comfort, or it's just like having to go to different places for their kids and for themselves for different procedures. So I was trying to make that more comprehensive so they can all be treated, from kids to adults to grandparents, teenagers, everything in between. So it's just really being able to, so that they can come in one place, get it all done, be happy, get a latte, Kids get their toys.
Oh yeah, that's another point. That you have that like children's area that has like 3 DVD players or Blu-ray players, and then you have this latte. Like I would come in just to get coffee, and then I'd probably bolt. I'm not gonna lie to you.
Well, that's okay.
I mean, it's super nice. I would hang out there. It's like a mini Starbucks, but it seems to be that your op in the entire office is set up more as a casual, like you're taking the fear of the dentist away.
Yes.
It's like a place you want to go.
Yeah, I mean, the warmth was a big thing for me. I wanted to create warmth. And with kids, especially with kids, they, you know, I have 3 kids, and to get them to go somewhere, you have to kind of create that excitement and that buzz for them to go, hey, oh yeah, I want to go there. Remember this, this, and this. So, I mean, I was thinking about my kids the whole time when I painted the mural in my kids' area.
And you painted that specifically, right?
Yes. I used to paint murals when I was 15.
Well, who didn't, but sure.
Yeah, you know, that was a side
I'm
job.
still doing it.
So I painted the mural, and then there's an iPad bar so they can watch and play their little games. And then I even have a Tooth Fairy op that I made that's in the wall, so the kids think, you know, that's where the Tooth Fairy takes care of like her patients and stuff, and all the little teeth that she collects. So I think it's just that magic for kids to come in, and they enjoy that a lot. And then afterwards, they get to open up the treasure chest with a special key, and they get to pick out a toy, and I think that's something that they like too. And then when they're during the appointment, they have these little iPads that they can watch as well. So distraction is key with kids, and they're always very happy.
So when you're looking at the I'm going to mess up the name of the place. What is it called? Your River Park in the Bridge Park area?
Yes.
So in the Bridge Park area is still being developed.
Right.
So you were on another show with me a couple weeks ago where I said we went into the doorway that had like a tractor inside of it and a mounds of dirt. So if you go the first floor, you're in the wrong place, right? So you have to go to the second floor.
It's a second floor.
But as that area is being built up, how many people did you say will live in that area? Because there's condos or apartments
There's condos, apartments, and townhouses that are being built. And I think it's like 1,200, 1,400 residents can live there. So the first floor is retail and restaurants. And they're actually adding 3 more restaurants in the spring, coming this spring.
So people can get their teeth cleaned and immediately get them dirty by going across these restaurants.
Yeah, absolutely.
Perfect. So in that area, you picked that area because, what reason? Just because it was newer? It's kind of like its own little mini city when it's done.
It's a mini city, yeah. And that's the thing. You're supposed to eat, work, play there. And so it's just having that foot traffic, and they're building that pedestrian bridge to kind of connect the Bridge Park with the downtown Dublin, so that's nice too. And then I think the goal with Dublin was to make everything just more pedestrian friendly, bike friendly. So they're making all these paths, so people that from Dublin can even ride their bikes down with their family and then enjoy the restaurants and go to the park and do all those things too. So and it's very community based, which I really like.
Well, it makes sense for your office to be there. Once that community is there, it's kind of everything's right there. It's like the old school suburbs used to be. You had your dentist in your area. It was like you could sometimes walk to it or drive 2 minutes away. But I like how it seems like everything you're doing is kind of like thinking down the road. Because once that thing is built, you got everybody there, right? There's not another dentist in your area that they're going to know about.
Not in that specific space. Yeah,
right.
Yeah.
What I'd like to do is talk a little bit about... Since this is our first show we've ever done, and again, we should state that this is actually the first show you've ever done.
First time I've ever met Mike. Second time.
Second time with a microphone involved, yes. We'll put it that way. So I think we should just kind of touch base on the things we're going to do down the line and talk in specifics about those. But today is just kind of like, that's a warm-up, right? Mm-hmm. So if we can cover some of the things that you do, that would be cool. Yeah. But what would you say right now is your main goal for the practice?
I mean, I know last time you asked me this question.
That was a different show. That was a totally different show.
Well, it's growth, it's growth, but then also it's to educate patients, to let them know that it doesn't have to be a scary experience, that it can be fun. But then to also engage with the community. I want to be able to hold fundraisers and sponsor athletes, from Dublin, or it's just being a part of the community altogether, and then just taking care of people.
When you say community, do you live in that area?
Yes.
I mean, I don't need the address. I just want to know if if you already live there. Because some
in
dentists
Dublin.
will drive like 50. They don't want to be by their office. Like they can't stand the thought of it, so they'll drive 15, 20 minutes. It's right in your backyard, really.
It's 5 minutes from my house, which I love because I have my 3 kids, so I want to be able to be a mom. When I go
You'd like
home.
to see them.
I'd like to see them, and then the last office I was at, it was a 45-minute commute back and forth, and sometimes more with all the construction. So it was getting to the point where I was not. It just that drive was every single day. It was just. I was getting a little ragey.
Right.
But with Dublin now, it's nice. I don't have to go on the highway. It's just go to my office. And it's nice, too, if anyone ever had an emergency and they called me on the weekend, I could just drop in my office and, get them a prescription or something or whatever it is. So it's just being able to give care when I want to immediately.
All right. Well, we should take a break. And you should celebrate. This is our first break we've ever taken on the show, right? So how do you feel about it?
I'm very excited.
Okay, we're going to go to break, but you will be back with River Park Dental. So we're going to come back and I'll talk about, we don't have to really get into these things. I just want to kind of mention like dental implants, dentures, the things that you do. And then
Not dentures.
Teeth whitening.
I know, but I hate doing dentures. I love surgery and root canals.
You do teeth whitening, of course.
Mm-hmm. Everyone does teeth whitening.
Yeah.
When you come back, I want you to say, how can people get a hold of you? You can plug the website, push them that way.
Now, do I have to come back in?
Yeah. Welcome back to.
Yeah. But you don't have to. You just introduce the show and get right back into it.
Okay.
So surgery, root canals. It's disgusting.
10 minutes, it'll go quick.
Yeah, it's gonna go real fast.
It's weird talking to you, because you're usually not serious, but you're radio serious.
Oh yeah. This is a totally different person. I want you off the air.
On the
You're
101,
so
on the 101 show, he's just a goofball. He and Madison and Andrew.
It's an hour long. It's longer than that when we take the breaks because we can't stay
I'm like, I
serious.
don't know if I can
Yeah.
look at Mike and not.
Yeah, first of all, that's racist.
And not laugh.
That's
racist.
Let's see.
I'm a communist.
Well, I know. You come from a communist country.
That's
Everything is
right.
polluted.
So were you born there?
Yes.
Oh, okay.
Yeah.
And then moved here
But
when
I
you were.
mean,
Oh,
when
we
9
need
months
that
old.
wall.
Oh, 9
Oh,
months
you
old.
mean you legally?
Yes.
All right.
Yeah.
I didn't know if your family came in containers. Okay. So
That's racist.
that is so racist. It's sweet. All right. So why don't you bring us back, and then I'm just gonna jump right in.
Ready?
Yep.
Here we go.
Welcome back to the River Park Dental Show.
Ping. I'm sorry. Dr. Ping.
Yes.
I've got a question. First of all, if people are listening to the show, how can they find out more about River Park Dental? Can they go to the website?
Yes. Website is riverparkdental.com, or they can call us at 614-689-8686, or they can. What else is there?
They
There's so many-
could send you a letter.
They can
Do you wanna
send
give
me
the
a
address?
letter. It's
Facebook request. They could do
Facebook, Instagram.
that. Yeah. Oh yeah. Let's plug the Instagram.
Yes.
No, you have to plug the Instagram. It's your Instagram.
I don't know what it is called.
Okay, so
I think it's
think
River
if
Park
you
Dental Dublin. River Park Dental Dublin.
Yeah, I wouldn't worry about getting that right. It's not a big deal. I guess show 2 will just be about Instagram.
Ellen
I'll
takes
teach you.
care of all that stuff
Yeah.
for me.
Thanks, Ellen, for not coming today. But you are very active on social media, right? So you're showing what you're doing
Yes,
with
my
your
practice
patients.
is active on there.
Right. And I saw some of the community events you've done in the past and the grand opening things.
Yep.
And a lot of pictures where it looks like you guys went to glamour shots. So it looks like a professional business.
Did I have a boa? That's,
No,
I mean,
no,
that's
but
only
you definitely
fine.
had that where you're kind of like looking at the sky over here and they're taking it front ways. A lot of the pictures that I'm seeing in these dental magazines that like everyone's looking away, like they're real pensive about things.
Oh,
You had
yeah,
that look
like that
going on.
thoughtful. I've never taken pictures like that.
I thought you were going to say you've
I
never
look
been
straight
thoughtful.
on and
Yeah. So
and
I was,
smile.
yeah, so it's very professionally done.
Yes.
So people will be impressed with that. But
Yes,
it also
a real
has,
photographer took our pictures.
yeah, it also has a list of everything that you guys do.
Yes.
And you said to me during the break that you love surgery and root canals, and I don't think I even asked you a question, and you just said that. So I think,
I like to offer.
right, I just wanted to, no, that's not what you said. You didn't say I like to offer that. You said I love to do that.
Yes.
So let's talk about, you had said that people find going to the dentist scary.
Yeah.
And they don't like it. They don't like the goop,
Yes.
all that. In that situation, if you love surgery and you love doing root canals, that is like, are you passionate about it because of the results of it, or you just really love digging in someone's face?
Well, I mean, a little bit of both. So I actually like the technical side of it. It's very like just the science and the technical part of just doing it with my hands. But then also it's, you know, giving someone a tooth back, like for implants, if they've been missing teeth for a while, then you restore function, aesthetics for them. Root canals, usually they're in pain or they've been sore, and to be able to take that pain away from them, those are that's rewarding too. So yes, I do like the actual technical getting in that tooth, but then I also like the aftermath, how the patient feels, like being out of pain or being able to have their tooth back.
So for you, the fun of it is the process and the result, whereas
yes,
really the person in that chair just wants a result.
Well, they want the result, yeah. But I take a lot.
But you see people's lives change because of the way their mouth and the way they smile and all that, right? If you have a problem, chances are you're going to try to keep your mouth closed as much as possible.
Yes, they might not smell as much. I've had a lot of people say they'll put their hand over their mouth.
They don't smell like
smile.
Oh, I thought you said they don't smell as much, and I thought, what is in their mouth that's so terrible? So they don't smile as much. I have seen that. I've seen the before and after.
They hold their hand up over their mouth and say, "Don't look at my teeth," or and it's just like
they wear a helmet.
Yeah.
Like that. But for you, that before and after, like that's got to feel good, right?
Yeah.
Like when you're restoring someone's smile, because that does restore not just function, but like how they feel about themselves.
Right. They're more confident. They feel better about themselves, and then it's also creating a healthy, I think, lifestyle, because then they see the benefits of having a nice, healthy mouth, and then they start doing other things too. Maybe eating better and exercising. It kind of all goes together.
Do you think it kind of trickles down to their family too?
Oh,
like
definitely.
Their kids and their wife or husband.
Yes.
Do you get a lot of families that you see that it started with one person? They're like, oh, I love this experience. I'm coming in because of this. Or...
Yes. So most of my patients come from referrals. So it just takes one person from the family, and then and it's usually the moms. The moms always test things out for the family. They'll come in, they're like, wow.
Oh, they're the guinea pig?
Kind
the
of.
Mom's like, I'll take any amount of abuse to see if my kids can take this?
Well, they're probably vetting the place just so their kids will be comfortable. They check out everything in the kids center. And then they will tell their husbands they just have to come. and
I remember being married and I had to show up at places where I was told I had an appointment, so I get that. So, again, we're going to cover more topics as we go down the line and do more shows, but I thought what was important to talk about was that you do dental implants, facial cosmetics, general dentistry in general.
Yes.
Right?
Yeah.
And whitening, because as you said during the break, everyone offers whitening. There's some whitening that's better than others, right?
Sure. It's all about the products that you choose. But yeah, there's different levels of...
But it must drive you nuts when you see a commercial on TV and you're like, that doesn't work for $60, or while you're wasting time, right?
Yeah, well, actually, the ortho, the one do your own ortho at home stuff drives me crazy.
I think that stuff works because anytime they say you can buy it at a Walmart or CVS, you definitely know that works. No, just read the instructions on the box and no one reads it. So you would recommend that?
Oh,
no?
yeah.
Or are you the one, like 4 out of 5 dentists agree you're the one dentist who doesn't agree?
I've never been asked, and I want to know who's asking
I just
those
asked
questions.
you.
No, I want to be one of the 5 dentists, and I have never been asked.
I feel like you would say no, just so it would be 3 out of 5 dentists, including Dr. Phing. I feel like you would be disagreeable.
I would give my honest opinion, and it'll probably be a no.
That's exactly what I said. Knowing you as I know you at this point, you would give the negative version of this. But again, before we run out of time, the other things that we're going to cover on down the line is the digital dentistry.
Yes.
That's a big deal for you. Oral surgery and infant tongue tie. Do you want to do like a minute on tongue tie right now? Because, do it.
What do you want me to say about it?
No, see, you're the dentist and the doctor. You have to say.
Okay, so there are a lot of babies that are being born right now that have a tongue tie, which is basically the little attachment from the floor of the mouth to the tongue. And if it's really tied up, the baby will not be able to nurse very well because they can't extend their tongue to breastfeed. So, what I do is just mechanically release that tongue so that they have full range of their tongue that can go to their palate. And that moms, it makes a huge difference. Moms always say that I'm handing a different baby back to them. It's not breastfeeding doesn't have to be painful. So it's great.
I just know that was a big subject that we have talked several times about, and we'll break that down in another show. But
yes,
it is very important that people understand that this is not just getting your teeth cleaned or flossing or getting a checkup. There are so many different facets to what you're doing, and again, doing tomorrow's dentistry today, there's a lot that goes into it. So we're going to break those subjects down. But I mean, I thought for our first show we slip in tongue tie. Everybody loves that. If they don't know what it is, now you know what it is. You're welcome. We probably have Jimmy, what do we got? We have 2 minutes left. Give me your summary of the first show.
What do you want me to say?
I mean, how do you feel about it? It was your first show ever.
I mean, of course I'm ecstatic. I don't know. This week has been the best week so far.
I feel like this was kind of like a letdown because you were named to the 40 under 40 list, and you're probably like, I deserve a show.
No, not at all. No, but it's nice to be able to talk about the topics I want to talk about and, really educate people. And, there are a lot of questions out there, and there's a lot of myths about dentistry, too.
That's a good point. If people had questions and they wanted to submit questions for you to answer,
yes,
how would they go about that? Couldn't they just go to the River Park Dental website?
They could.
Can they call Ellen on her cell phone?
Sure. Do you want me to get her cell phone?
Yes, on the air. I would love that. Or they could go on your Facebook page and they could probably submit questions there. And if anything you want addressed at any time, if you submit it, we will go ahead and discuss that.
Yep, absolutely.
All right, cool. We have 1 minute left, so we're going to have to take this home. Is there anything you want to say to people right now? I think you should plug the website.
Yes, come visit us at riverparkdental.com or in person. Just come to us at Bridge Park. 6605 Longshore Street.
I love it. And don't go to the bottom part, the retail part, because there's
upstairs.
mud
Suite
and tractors. Yeah,
220.
go upstairs, please.
Yes.
Dr. Phing, I think this is a great first show for you.
Yes, it was. Thank you.
And we'll be back next week with River Park Dental.
Thanks for watching. And Dr. Phing, now your building is near that huge roundabout that half the people that drive through it don't know what they're doing, the Roundabout of Doom, which, for those of you that aren't familiar with Dublin, this is at Riverside Drive, or 33 if you will, and 161, or Dublin Granville Road. That's where her office is. Bye-bye.